This is a stabilization program designed by Stuart McGill for a population of patients with low back pain. So it's recommended that the stabilization routine begin with the cat-camel exercise. It is done in the quadruped position with the hips directly above the knees and the arms directly beneath the shoulders. This exercise is used to decrease spine viscosity and to floss the nerve roots as they exit at each lumbar level. So the motion is as follows. First, you're going to come up into flexion. As we do so, the whole back, we're looking to round the back, incorporating the thoracic and the cervical spine as with the lumbar spine. And then we're going to go ahead and reverse, down into extension, again incorporating all three levels of the spine, the lumbar, thoracic, and cervical. It is important to note that this exercise is intended for motion and not a stretch, so the emphasis is not to push the end range of flexion and extension, and good form includes the integration of all three spinal segments. So as the back comes up, the head goes down, and vice versa. As the back goes down, the head comes up. The next exercise is called the curl up. For this one, the hands are placed under the lumbar spine to preserve a neutral spine posture. Do not flatten the back to the floor, as flattening the back flexes the lumbar spine, violating the neutral spine principle, and increases the loads on the disc and the ligaments. One knee is flexed, as the other is straight to lock the pelvis lumbar spine and minimize the loss of neutral lumbar posture. Alternate the bent leg midway through the repetitions. So the curl up is performed as follows. You're going to raise the head and the upper shoulders off the mat. The motion takes place in the thoracic spine, not the lumbar or the cervical region. It's important to note in neutral neck position to decrease the stresses placed on the cervical spine. The exercise is made more challenging by raising the elbows off the floor as well. Even more challenging is first performing an abdominal brace, activating the abdominal muscles, and then curling up against that brace. Do not hold your breath, but breathe deeply, and do not increase the challenge by increasing the intensity of the abdominal brace. Hold the posture for 7 to 8 seconds, and repeat until failure. Then you will alternate your legs, and continue to complete the motion to failure on this side. The next exercise are the clams, which focus on the glute medius and the external hip rotators. For this, the patient will be laying on their side or propped up on their elbow with the hips and knees flexed to about 60 degrees. You're going to place the top hand on the top hip, and we're going to slide the top knee about an inch or two over the bottom knee. So we're just going to bring it forward a tiny bit. What this does is further isolates those target muscles for the exercise. In this position, we're going to keep the feet together and keep our hips in the stacked position, and we're going to then raise the top knee away from the bottom knee as far as we can without allowing the hips to roll open. You're going to hold this position for 8 to 10 seconds, and then you're going to come down and rest. Incorrect form of this exercise looks something like this. As the knees come apart, the motion is led by the rolling of the hips. So again, incorrect form would be to allow the hips to roll open. Correct posture is to maintain the hips above one another in the stacked position. We want to move the knees independently of the pelvis. A progression for this exercise would be simply increasing the hip angle, which lengthens the moment arm of the target muscle, as well as adding a simple resistance band between the knees can be done for increasing intensity. A further progression would be the super clam, which is done in a static side plank position. And from this position, maintaining the hips, again in the stacked neutral position, the knees are then drawn apart and held for 8 to 10 seconds. Patient will complete this exercise to fatigue on this side, and then they will be instructed to flip over and complete the exercise identically on the opposite side, again to fatigue. The next exercise is called the bridge. This focuses on glute activation. For this one, the patient will be laying supine on their back with their hips and knees flexed up as high as they can, bringing the heels as close to the buttocks as possible. What this will do is passively inhibit the hamstrings and allow for mainly glute recruitment. So we're going to begin this exercise by making sure the patient can differentiate glute activation from hamstring activation with a simple glute isometric exercise. Once the patient is able to contract the glute, we are going to then go ahead and raise the buttocks up off the mat. This position will be held for 8 to 10 seconds, and then return to the mat for rest. The exercise will be repeated until fatigue. A simple progression of this exercise would be to decrease the base of support. So starting with the hands along the sides, we can then put our hands on our stomach with the base of support coming from the elbows. Further progression would be to cross the arms across the chest and having no contact with the upper extremity on the mat at all. A further progression would be to decrease the base of support at the feet. So for this, we are going to regain contact with the upper extremity, and then we are going to bridge up and kick out one leg, keeping the thighs parallel to each other and making sure that the hip on the extended leg does not drop. So again, we're going to come up into a bridge. We are then going to kick out one of the legs, keeping the thighs parallel and making sure that the hip that is extended does not drop and the pelvis stays level. Again, these positions are held for 8 to 10 seconds and repeated to failure. With the progression of the single leg bridge, we will complete the exercise to fatigue on one leg before moving to the next. This next exercise is called the bird dog. This exercise is mainly for the back extensors, both lumbar and thoracic. We're going to begin with the patient in the quadruped position with the knees directly beneath the hips and the arms directly beneath the shoulders. We're going to hold this position with an abdominal brace for about 10 seconds. Once the patient is able to appropriately brace the abdominals, we are then going to proceed and extend the right upper extremity with the left lower extremity. This position will be held for 8 to 10 seconds. The key is to maintain a neutral pelvic position. You do not want to allow the pelvis to drop. Once you get to 8 to 10 seconds, the extremities will then sweep the surface to touch one another and then return to the extended position, again to be held for 8 to 10 seconds. This motion is repeated until fatigue and then completed on the other side identically, again beginning with an abdominal brace and then extending the upper and opposite lower extremity, maintaining the a neutral pelvis throughout the motion and the abdominal brace. The bird dog can be progressed simply by adding cuff weights to the wrist or to the ankle, and the motion will be the same. You want to extend the opposite arm and leg. With the added resistance, the exercise will become more difficult. If this exercise is too advanced to begin, we can start with just moving one limb at a time, whether it's the upper or the lower extremity. So a key for the regression of this exercise is to maintain the abdominal brace throughout the movement, and if the lower extremity is being extended, a neutral pelvis is key.
Next exercise is the side plank. We're going to begin the position on your side. We want to have a straight line between the ears, shoulders, hips, knees, and ankles from a side view, and then we also want a straight line in the nose, belly button, through the middle of the legs and ankles. We're going to begin the position with a nice depressed shoulder, and you're going to then plank up your hips off the table. In this position, you're going to hold for 8 to 10 seconds and repeat until fatigue. And as you can see, he is maintaining a straight line through the nose, belly button, legs, and ankles. And you want to maintain neutral spine throughout the entire process. We want to avoid any rocking back or rocking forward throughout the motion. So if in the side plank position, rocking forward or backward, or unable to maintain a neutral spine persists, we can make the exercise easier by flexing the knees to 90-90 and maintaining the straight line between the knees, hips, shoulders, and ears. We want to also maintain shoulder depression to protect the shoulder as well. And again, you're going to hold 8 to 10 seconds and repeat to fatigue. The next exercise is called the Around the World. This is a combination of side planks and standard planks. We're going to begin the position in the side plank. The top foot is going to be the lead foot. This will allow for easier rotation. We're going to begin the exercise lifting the hips, maintaining a neutral spine and shoulder depression. We're going to hold for 8 to 10 seconds and then turn to a standard plank. Standard plank, if you're looking laterally, you want to maintain a straight line between the ankles, knees, hips, shoulders, and ears. Again, you will hold for 8 to 10 seconds and side plank on to the other side. Also making the top foot lead foot for when you transition back to a standard plank. You're going to go around the world until fatigue, holding 8 to 10 seconds in each position. This next exercise is called Stir the Pot. We're going to begin from the knees, and we're going to go into a standard plank on a dynamic surface such as a Theraball. You're going to maintain neutral spine and shoulder depression while performing small concentric circles, both clockwise and counterclockwise. You can either hold for a number of seconds or for a number of reps to each set. To make this exercise harder, we can advance from going from the knees onto the toes, continuing making small concentric circles, both clockwise and counterclockwise, maintaining a neutral spine. Repeat exercise until fatigue. Low back exercises are most beneficial when performed daily. The no pain, no gain caveat should not be followed in this case, as it will only create damage to the patient.
So it would be unwise for a patient to perform these exercises first thing in the morning due to the fact that the intervertebral discs will be most hydrated at that point, allowing for full range of motion to be difficult due to the compressive forces on the spine. Being that stabilization is an endurance factor, not a strength factor, endurance should not be overemphasized by strength. Since all patients are different, there's no one ideal set of exercises for everybody. It's important to be patient with this program, as an increase in function and a reduction in pain may not occur for upwards of 3 months.